What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, November 21st, 2023. That's right, the COVID pandemic's not over. As you can hear, there goes another ambulance. And we're not done with reporting on the pandemic. In today's pandemic update, we are going to talk about the latest symptoms of COVID. That's right, COVID is rising. The number of ambulances out here is increasing. There has been a ton of ambulances lately. And before we get into the symptoms of COVID, I do have to tell you a few news and notes today. Some not so good things are happening around the world. First off, Finland and Sweden are seeing a rapid increase in wastewater. And it doesn't stop there. They're also seeing a rapid increase in COVID hospitalizations. Literally, Finland, I just saw a chart. Finland is literally going straight up right now. But it's also rising in Australia. Now, a lot of you are probably thinking, oh, well, it's getting into the colder months. True for Finland and Sweden, not true for Australia. Australia is in spring right now. They're going to be going into summer pretty soon. They shouldn't be seeing another massive surge right now. Now, there's a lot of speculation. Could it be JN.1? Could it be BA 2.86? Australia's case, yes. Sweden, I read someone said that it's not a new variant. It's just a rise. Some others are saying, speculation, maybe it's part of JN.1. Don't know what's causing it. But the point is, there are many places that are seeing a rapid rise. Unfortunately for us here in the United States, over the past few days, that rise is starting to become prevalent as well. It's starting to show up in the data. It's starting to show up like a light switch. We're going from just bouncing around, slowly going up to the start of rapidly rising. And there was a new forecast model that came out last night that I saw. I retweeted it on Twitter. A guy by the name of Mike, I forget what his last name is, but he tweeted it out, and yeah, it's not good. It shows that by middle of December, the United States is going to be close to 1.3 million cases a day as estimated by wastewater. That's what the estimate will be. That you will never see 1.3 million cases reported by a CDC report or anything else in daily, because not that many people will get tested. But that's what the estimate's going to be by mid-December, if his model is correct. And that is really bad. If we see 1.3 million cases a day, you're talking somewhere between maybe 50,000, maybe over 100,000 new long COVID patients a day that will go on to get long COVID, should that happen. So all signs are pointing towards this is going to be a really bad winter surge. And the potential's there. I've been saying this. The potential's there. This could get worse than last winter. And the baseline that we're starting off with is really high for deaths. Deaths are already, we had 1,283 deaths last week in the United States. That should drop for a couple more weeks, but at some point that's just going to do a quick reversal and go right up, and who knows how high it goes. If we do that many cases in a day, if we do 1.3 million cases in a day by mid-December, mind you, there would still be the rest of Hanukkah, Christmas, New Year's. There would be more to come. So, that would likely maybe peak and then go up again around the Christmas holidays, around, the holidays at the end of December. So, who knows how high deaths are going to get this year, because we know so many people have chosen not to get a booster. There's so many people. They've only had the first 2 shots. And when was that? Yeah, 2021. That's been quite a long time. Alrighty, that's enough of the news and notes. So, maybe you're starting to feel sick. Maybe you're someone, you clicked on this video, you're starting to feel sick. And you're thinking, oh, it's just a cold? Well, I got some data here for you direct from the CDC that tells you what could be symptoms of COVID. We've gone over this before. It's time we go over this again, because there are so many people right now that are getting ready to do Thanksgiving gatherings. holiday gatherings and whatnot, and they're starting to feel sick and they're scrambling. Shoot, what's the symptoms of COVID? Well, I got them right here. So people with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Anyone can have mild to severe symptoms, and as we know, when they say anyone, you could be someone that is perfectly healthy, never had a health issue, or someone that is high risk, immunocompromised. It goes on. So here are the most common symptoms of COVID. Fever or chills. That's something you also see with the flu and many other viruses. Cough. That's something you see with a lot of other viruses. Shortness of breath or difficulty breathing. While in severe cases of flu that can happen, it's more common with COVID. Fatigue. Muscle or body aches. Headache. New loss of taste or smell. Doesn't happen as much as it did previously, but I'm still hearing of it happen. I know someone who had COVID. They didn't feel like eating. They lost a lot of weight. And this was very recently. Sore throat, congestion or runny nose. Now, let's go back to sore throat, congestion or runny nose. Two things that could be of allergies. So if you're saying, oh, it's just allergies. No. Take one of those rapid at-home tests. You can order 4 more free ones right now. Take one. It could be COVID. It's on the list. Nausea or vomiting and diarrhea. Yes. These are all things that could be COVID related. Now, I'm going to add something that I've been hearing about with this BA 2.86 and JN.1. Something I've been hearing about is rashes. Apparently, that's a thing with this newer variant, so it's something we'll have to look out for. In previous variants, there have been rare cases. Actually, no, last winter it wasn't so rare. It was pretty well prevalent. Cases where people would get pink eye while having COVID. So look out for that as well. Then we go on to this. When to seek emergency medical attention. Look for emergency warning signs for COVID-19. If your shortness of breath and difficulty breathing gets so bad, or you feel like your O2 saturation is really dropping, call 911 or get to the ER. Persistent pain or pressure in the chest while being sick with COVID. Seek emergency attention for that. New confusion. Maybe you're just getting really confused. You don't know what's going on. Or you have a combination of these symptoms. Seek emergency attention. Inability to wake or stay awake. And that's something that can get really serious. And a lot of people that go on to get long COVID often end up with that where, they can get up to go to the bathroom. Or they could wash a dish or something. Then they got to go back and lay down and go to sleep. That's something, it's a real problem. Then we come to this. Pale, gray, or blue-colored skin, lips, or nail beds. Deepening on skin tone. So that's something that you need to pay attention to for emergency medical attention. And any of these things that I just listed, where you need to seek emergency medical attention, don't sit there and think, oh, well, that's just people of older ages. No. People of all ages. There are kids that get hospitalized with COVID too. There are teens. There are young adults, middle age. Any age can end up in the hospital. And unfortunately, any age can end up on a ventilator from COVID. Yes, it still is a thing. We're watching hospitalizations explode in other countries. We're going to lag them about a couple weeks, and we know darn well it's coming. Thanksgiving's coming. I mean, I've been seeing the crowds at the stores lately. It matches 2019. I thought last year, wow, people are really doing Thanksgiving 2019. This year's even crazier than last year. I mean, I'm reading traffic projections. Pennsylvania, state I live in, Pennsylvania Turnpike, they just said 3.3 million motorists are going to travel over the Thanksgiving holiday. So, yeah, and that's just vehicles. That's not including some vehicles will have 3-4 people inside. Yep, it's happening. Thanksgiving in America is happening. The post-Thanksgiving wave, it's going to happen. It's going to be pretty intense because we're already starting to explode, and everyone has not gathered yet. Everyone hasn't done the Wednesday night before Thanksgiving, go out and meet up with their buddies. The Thanksgiving Day, 10, 15, 20 plus people gatherings. They're happening. Look out for these symptoms. If you have these symptoms prior to going to a Thanksgiving gathering, Test for COVID. And also, mask. I've said this yesterday. I said it today. Well, I'm saying it now. I'm going to say it again tomorrow. Mask when you're traveling. Mask at those rest areas. They're going to be jam-packed with people. And there will be people in there that match these symptoms. If you see someone that matches any of these symptoms, steer clear. Avoid them. Mask. Go somewhere else. Also, keep an eye on your air qualities. Yeah, mine's not too great right now. My windows are up. It's cold here this morning. It's 35 degrees outside and it's going to rain today. But if you're seeing any of these symptoms on this list, by all means, steer clear of the person. And speaking of cold, that's another reason why things go up in the wintertime. These viruses like colder weather, and more people go inside in colder weather. Now, one last tip. If you are in somewhere where it's going to be a warmer climate, and maybe you have a nice patio, you have a nice backyard, try and do Thanksgiving outside. Maybe set up some tables outside and do it outside if you can. I mean, not everyone's going to be up in the north where it's cold. And if you're anywhere else in the world, maybe you don't celebrate Thanksgiving. Maybe you're in Sweden, Finland, the UK, Australia, anywhere. These symptoms are good to follow for you as well because they are the current symptoms of COVID. Many of them match RSV, flu, other colds, and other stuff that are going on. Test for COVID multiple times. And if you do come up negative, by all means, go out and seek testing for the other viruses as well. Don't just sit there and act like it's no big deal. It can become a big deal. Doesn't necessarily have to be COVID for you to develop a new long-term symptom, though we do know long COVID is the biggest issue at hand right now with a post-virus infection. I mean, there's going to be, I hate to say it, with this winter wave, we're going to a few million more people are going, just in the United States alone, are going to be added to the long COVID list. We're also seeing up in Canada, cases are rising up there as well. Hospitalization soon to follow. And, long COVID soon to follow. So, yeah, that's what I got for you guys today. If you find this if you found that I educated you on anything here, give this a thumbs up, especially if you like this content. And if you want to see more stuff like this, subscribe to my channel down below. I will see you all again tomorrow for the Thanksgiving Eve pandemic update. Until I see you again next time, stay safe, everyone. Share this information with those that need to see it. And have a great Tuesday. See you all again next time. Take care.